Headache. You feel a headache when pain-sensitive structures in your head get activated. The brain itself does not feel pain, but the surrounding blood vessels and nerve endings do. When these blood vessels expand or tighten, they send signals through nearby nerves, which you experience as pressure or throbbing pain. This often happens when your body is under stress or low on fluids. For example, when you sit for long hours looking at a screen, your muscles stay tight and stress signals affect blood flow, which can create that band-like pressure around your head. In the same way, if you go hours without drinking water, your blood volume can slightly drop, reducing oxygen delivery and triggering a dull, heavy headache. In both cases, your body is reacting to changes in blood flow and nerve signaling. Fatigue. You feel fatigue when your body is not producing or using energy efficiently at the cellular level. Every cell in your body relies on oxygen and nutrients, especially glucose, to produce energy in the form of ATP. When this process slows down or becomes inefficient, you start to feel low energy, heavy, or mentally drained. This can happen due to lack of sleep, poor nutrition, or low oxygen delivery. For example, when you do not get enough sleep, your brain and body do not fully restore energy levels, so you wake up already feeling tired. In the same way, if your meals lack essential nutrients like iron or vitamins, or if oxygen supply is reduced, your cells cannot produce enough energy. As a result, you feel constant tiredness because your body is struggling to meet its energy demands. Indigestion. You feel indigestion when the digestive process in your stomach becomes unbalanced or slows down. Normally, your stomach releases acid and digestive enzymes to break food into smaller components. When this acid level is too high, too low, or digestion becomes slow, food does not break down properly, leading to discomfort. This can happen when you eat too quickly, consume heavy or oily foods, or your stomach takes longer to empty. For example, after a large meal, your stomach may produce excess acid while also slowing its movement, which creates a feeling of fullness, burning, or bloating. In the same way, if digestion is delayed, food stays longer in the stomach, increasing pressure and irritation. As a result, you feel heaviness and discomfort because the normal breakdown of food is disrupted. Constipation. You feel constipation when movement inside your intestines slows down. Normally, your intestines use rhythmic muscle contractions, called peristalsis, to push waste forward. When this movement becomes slow, waste stays longer in the colon. As it stays there, more water gets absorbed from it, making the stool dry and hard. For example, when you do not drink enough water or stay inactive for long periods, this movement slows down and the colon keeps absorbing water, which makes passing stool difficult. In the same way, low fiber intake reduces the bulk needed to move waste smoothly. As a result, you feel difficulty, strain, or incomplete emptying because the normal movement and hydration balance in your intestines is disrupted. Diarrhea. You feel diarrhea when movement inside your intestines becomes too fast. Normally, food and fluids move at a controlled pace, allowing enough time for water to be absorbed. When this process speeds up, the intestines do not absorb sufficient water. This often happens due to infection, irritation, or certain foods that disturb the intestinal lining. For example, when your body detects harmful bacteria or toxins, it increases gut movement to quickly remove them, which reduces water absorption and leads to loose stools. In the same way, irritation in the gut can trigger rapid contractions, pushing contents out before proper digestion. As a result, you experience frequent watery stools because your body is trying to clear out something while sacrificing normal absorption. Back pain. You feel back pain when muscles, ligaments, or the spine itself experience strain or pressure. Your spine is supported by muscles and connective tissues, which help maintain posture and allow movement. When these muscles tighten, weaken, or get overstressed, they transmit pain signals to your brain. This often happens due to poor posture, heavy lifting, or long hours of sitting. For example, when you slouch at your desk for hours, your back muscles stay tense and the pressure on your spine increases, creating a dull or sharp pain. In the same way, lifting objects incorrectly can strain muscles or compress spinal structures, triggering discomfort. As a result, you feel stiffness, soreness, or sharp twinges because your back muscles and spine are under stress beyond their normal support capacity. Chest discomfort. You feel chest discomfort when muscles, nerves, or the upper digestive system send signals that something is off. The chest area has many structures, muscles, ribs, nerves, and even the esophagus, that can cause pain or pressure when irritated. This often happens due to muscle strain, acid reflux, or minor digestive issues. For example, after heavy or spicy meals, stomach acid can flow back into the esophagus, creating a burning sensation in the chest. In the same way, overworking chest muscles during exercise or sudden movements can cause soreness or tightness. As a result, you feel mild pressure, burning, or aching because your muscles or digestive system are sending signals to your brain about stress or irritation in the chest area. Shortness of breath. You feel shortness of breath when your body is not getting enough oxygen or when the lungs and blood cannot exchange oxygen efficiently. Your lungs, blood, and heart work together to deliver oxygen to every cell, and any disruption in this process triggers the feeling of breathlessness. This can happen after physical exertion, allergies, or mild respiratory irritation. For example, when you climb stairs quickly, your lungs need to work harder to bring in oxygen, making your breathing rapid and shallow. In the same way, if your nasal passages are blocked or lungs are irritated, less oxygen reaches your blood, causing a sensation of tightness or short breath. As a result, you feel your chest tight and your breaths faster because your body is signaling that oxygen delivery is temporarily insufficient. Skin problems. You notice skin problems when the balance of oil production, inflammation, and cell turnover in your skin is disrupted. Your skin has oil glands, immune cells, and layers of tissue that work together to protect and repair it. When this balance is off, issues like acne, redness, or irritation appear. This often happens due to excess oil, clogged pores, or minor infections. For example, when your skin produces too much oil and pores get blocked, bacteria can grow and cause pimples. In the same way, irritation from certain soaps or environmental factors can trigger redness or rashes. As a result, you see bumps, redness, or irritation because your skin is signaling that its protective and repair systems are under stress. Dizziness. You feel dizziness when your brain does not get a steady supply of blood or when your balance system is disrupted. Your inner ear, eyes, and brain work together to keep you stable, and any change in signals can make you feel lightheaded or unsteady. This often happens due to sudden standing, dehydration, or low blood sugar. For example, when you stand up quickly after sitting for a long time, blood flow to your brain may drop briefly, making the room feel like it spins. In the same way, if you are dehydrated or haven't eaten for hours, your brain receives less oxygen and energy, causing a wobbly, dizzy feeling. As a result, you feel unsteady, lightheaded, or off balance because your body is signaling that the balance between blood flow, oxygen, and sensory input is disturbed. Sleep problems. You experience sleep problems when your brain signals and hormone levels are not properly aligned to regulate rest. Sleep depends on a balance of hormones like melatonin and cortisol, along with signals from your brain that tell your body when to feel sleepy or alert. This often happens due to irregular routines, stress, or environmental disturbances. For example, when you stay up late using screens, the light can suppress melatonin, making it harder to fall asleep. In the same way, high stress levels increase cortisol, keeping your mind alert even when your body is tired. As a result, you struggle to fall asleep, wake up frequently, or feel unrest because your body's internal sleep signals are disrupted. Weak immunity. You notice weak immunity when your body's defense system cannot respond effectively to germs or recover quickly from illness. Your immune system relies on white blood cells, antibodies, and signaling molecules to detect and fight infections. When these components are low or slow, your body becomes more vulnerable. This often happens due to poor nutrition, lack of sleep, or chronic stress. For example, when you frequently skip essential nutrients like vitamin C or zinc, your immune cells cannot function at full strength. In the same way, not resting enough prevents your body from repairing and producing new immune cells, making you catch colds or infections more often. As a result, you get sick more easily and take longer to recover because your body is signaling that its defense system is underperforming.